I'm Dr. Saachi Bridges. I've been practicing for a little over 5 years and yeah, just loving every bit of it. My dad is a physician, so just kind of growing up, seeing him in the healthcare field and just how rewarding it was for him. I knew at a young age that I wanted to go into the same thing, so I kind of shadowed, like physicians and dentists and pharmacists, physical therapists, and I just felt a bigger connection with dentistry. I felt like it was a great combination of like art and science, which are like my two passions. So yeah, ever since I kind of figured that out, I sort of just kept pursuing it, and it's great. I feel like it's probably 40% art, 60% science, but art is a really big component of it. Just not from only like a cosmetic standpoint, but I mean, we're using kind of intricacies of tools in our hands and stuff all day. So it's almost like surgery. Everything that we do is surgical, but it's not big surgeries every time, but in the sense that we're using like micro tools and stuff the whole time. So the dental procedure that I enjoy the most is probably anything related to like orthodontics. So like Invisalign, we do a lot of Invisalign. That's like clear aligners. I feel like it's just, you get to see things kind of moving in real time. You get to see a lot of benefit, not only to like oral health, but just kind of benefit to patients' smiles and just like a really lasting impression on a lot of people's smiles. I feel like it always gives patients a little more confidence too. And I really just like the background side of it. The intricacies of, like being very precise with getting people's bite in a certain position and stuff, so. I mean, just patients in general saying that they have a good experience, that they feel comfortable, that we give them like a really nice experience when they come here, and they feel very taken care of, and they kind of like the whole staff from start to finish, so I feel like that's always been a nice feeling. People don't really think that flossing is that important, but it really is. I remember reading this study when I was in dental school that if you were to give up either brushing or flossing, which one would affect your oral health more? A couple dentists did one part of the study where they stopped brushing and they only flossed, and then somebody else who had very similar kind of health, they stopped flossing and only brushed, and it was a lot more effective to floss than it was to brush. But all to say that flossing is very important. I think a misconception that people don't know is if you're flossing at night, I would floss first, so kind of get everything out from in between your teeth first. Use your toothpaste, spit everything out, but don't rinse. You're kind of letting that fluoride toothpaste not only like seep in between the teeth because you got everything out from flossing first, it just helps overall with health. It's a very small thing, but I feel like it makes a big difference. I know a lot of folks, especially adults, we love our coffee in the morning. We like our red wine occasionally here and there. I know people don't like it because it stains their teeth. You can even just like floss after you've had either of those things, and it helps keep your teeth whiter. I've noticed like a pretty big difference when I tell patients to do that because it stains really easily in between your teeth, but even just kind of flossing in between will help keep things whiter. One thing that I noticed basically immediately when I started working for Enamel is just how we're a lot more focused on preventative care, like teaching patients how to maintain their oral health, as well as just a lot more technology and comprehensive care, going into a lot more detail about educating them on everything that we see, as well as just like not being pushy about certain dental treatments. I feel like most of the dentists that I've worked with at Enamel are a lot more conservative with their treatments, which I think is great for patients. And then finally, Enamel is a really big community. Like we have a lot of dentists in our company. So I feel like dentistry is a field where we should be kind of coordinating with other dentists, and it's nice to kind of get feedback from multiple professionals. Well, my favorite candy is like the watermelon Sour Patch. I love those. That'd be a fun, maybe not a great toothpaste flavor, but maybe for like a moment, it'd be fun. My favorite part of the day that's like very simple, but it's just like having enough time in the morning just to like sit and have my coffee. Like there doesn't need to be anything, like TV on, nothing. I don't really need to be outside or inside, but I just love to like either sit on my couch or on my kitchen table and just like have a cup of coffee.